Namaskar. I am Dr. Nidhi Nayyar. I am Gynaecologic Cancer Surgeon at BLK-Max Super Specialty Hospital, and today I would be speaking about cervical cancer. Cervix is the lower part of the body of the uterus that connects the uterine body to the vaginal or the birth canal. Cervical cancer is the second most common cancer in Indian females after breast cancer. It was found that globally around 600,000 women suffer from cervical cancer. Out of these, around 123,000 females suffer from cervical cancer in India. Among these, around 70,000 deaths were reported due to cervical cancer in the year 2020. Now, the high mortality rate because of cervical cancer in India is because of lack of awareness and lack of screening strategies. Females with cervical cancer report in a very advanced stage, which leads to high mortality rates. And we all know that if cancer is detected in early stage, it is amenable to cure. The most common cause of cervical cancer is persistent infection with high-risk HPV strains. HPV is human papilloma virus, and the infection with this virus is acquired through sexual contact. Around 80 to 90% of females will be infected with human papilloma virus in their lifetime. But this does not mean that every female with HPV infection will develop cervical cancer, because it is the body's immunity that clears the virus in subsequent 2 years. In those females who are not able to clear the virus and the virus remains persistent in cervical cells, then this causes precancerous changes which eventually lead to cancer. Now, the time period between HPV infection, the persistent infection, precancerous changes, finally developing to cancer spans around 10 or maybe 20 or even 30 years. So this provides us with a window of opportunity to intervene, go for screening tests and treat the precancerous changes only before cancer develops. So we can say that cervical cancer is a truly preventable cancer by screening and as well as vaccination. Coming to the screening tests for cervical cancer, there are two types of tests, the Pap test and the HPV DNA tests. Both these screening tests are painless tests which can easily be done on an OPD basis during a normal gynecological examination. We do now have a vaccination against cervical cancer. In India, two types of vaccines are licensed. One is the quadrivalent vaccine and other is the 9-valent vaccine. The ideal age group for these vaccinations is between 9 to 14 years of young girls, as it is said that the efficacy of the vaccine is 100% if it is given prior to any sexual exposure. Although the US FDA has approved the vaccination even up to 45 years of age, but at older ages, the efficacy of the vaccine does reduce. So it is recommended ideally to be given to young girls before any sexual exposure. The dose of the vaccination is a 2-dose schedule at less than 15 years of age, and beyond 15 years of age till 45 years of age, a 3-dose schedule of the vaccination is recommended. So if we all together come for screening as well as vaccination, we can all have the burden of cervical cancer reduced in our country, and this cancer can be made to be a rare cancer.